Welcome all to the Nursing Officer exam preparation videos for various government institutions. This is the part 2 video for exam hall confusing topics with memory tips and multiple choice questions. The part 1 video is already uploaded and the link is given in the comment section. Please refer it for your exam preparations. Sometimes when you find very easy questions, you will be excited and you will not see the negative words or similar options in the question, ending up in choosing the wrong option. The multiple choice question upcoming is an example for that. The question is a congenital anomaly in which the urethral opening is in the ventral surface of penis is termed as A. Hypospadias, B. Epispadias, C. BPH, and D. Hydrospadias. As you know, the answer is A. Hypospadias. But sometimes, due to an excitement of an easy question, you will directly go to the option D. Hydrospadias without reading the spellings properly. So you will end up in missing a simple question and one valuable mark and ending up in negative mark. This kind of similar spelling options will be sometimes given purposefully to misguide you. So don't go to that negative mark trap. We have to practice with memory tips to boost our memory to avoid all kind of confusions in exam hall.
This channel want to make sure that you study this perfectly without any error or doubts and you are gradually stepping into the success.
There are many types of memory tips including color codes, short forms, picturization, familiar to unfamiliar, etc. I always use the color code and picturization for my topics to get a better memory. Please observe carefully the color which is used in the different topics to relate. Many shortcuts are used for connecting the topics and getting a better memory. Please remember these shortcuts for your exams. Instead of studying a lot in the previous day of exam, you can use these shortcuts to boost your memory and revise all the topics in a short time. Let us start the topic session. Let us go to the first topic now. The first topic is sutures of the skull. Before starting the session, let us have some multiple choice question. Answer these questions carefully. Hope that you have completed all the questions with the right answers. Let us go to the explanation session now. After completing this session, you will never get any wrong answers from this topic anymore in your exams. Coronal suture is the transverse suture in the skull separating the frontal bone from the parietal bone. Sagittal suture. It connects the two parietal bones in the middle of the skull. Lambdoid suture. It connects the parietal bones with the occipital bone. Metopic suture. It separates the two frontal bones in the middle of a child's forehead. The sutures of the skull. This topic we will remember with two methods. One is picturization and second is short form method. Let us see this picture and get a clear idea about the position of all the sutures and the bones in the skull. Now let us have some memory tips with the short forms. Remember this short form PPS, PFC and POL. The first one is PPS. Parietal plus parietal is equal to sagittal. So the sagittal suture is situated between two parietal bones. PFC is parietal plus frontal is equal to coronal. So the coronal suture is between parietal and frontal bones. The third word is POL, that is parietal plus occipital is equal to lambdoid. So the lambdoid suture is between parietal and occipital bones. Last one is the frontal plus frontal is equal to metopic. That means metopic suture is between frontal bones. Now let us see brachma and lambda. Brachma is the anterior frontal which is diamond shaped and diameter is about 2 to 4 centimeter. It diffuses at 12 to 18 months. Lambda is the posterior frontal. It is triangular shaped and diameter is 1 to 1.5 centimeter and it fuses at 1 to 3 months. Now let us see the picture of brachma and lambda for the better memorization. Remember this BAT 12 to 18, LPT 1 to 3. Brachma anterior diamond shape fuses 12 to 18 months. That is BAT 12 to 18. Lambda posterior triangular shape fuses at 1 to 30 months. That is LPT 1 to 3. Hope that you successfully cleared this topic and you will remember all this point. Now let us go to the second topic. Here we will see some lung parameters including lung volume and capacities. Similar to the other topic, let us have some multiple choice questions before we start the session. Hope that you have completed all the questions with the right answers. Let us go to the explanation session now. After completing this session, you will never get any wrong answers from this topic anymore in your exams. The tidal volume is the amount of air passes into and out of lungs in each cycle of quiet breathing. Inspiratory reserve volume is the extra volume of air that can be inhaled into the lungs during maximum inspiration. Expiratory reserve volume is the largest volume of air that can be expelled from the lungs during maximum expiration. Residual volume is the volume of air remaining in lungs after forced expiration. Vital capacity is the maximum volume of air that can be moved into and out of the lungs. Inspiratory capacity is the amount of air that can be inspired with maximum efforts. Functional residual capacity is the amount of air remaining in the air passage and alveoli at the end of quiet expiration. Let us see some memory tricks and formulas. Vc is equal to Tv plus IRV plus ERV. Vc is equal to vital capacity, that is the maximum air moved into and out of lungs. Tv is the tidal volume, the normal breath air moved into and out of lungs. IRV is the inspiratory reserve volume, extra air in maximum inspiration. ERV is the expiratory reserve volume, the largest air in maximum expiration. Residual volume and functional residual capacities are amount of air remaining in lungs after forced and quiet respiration respectively. Let us have a quick recap of this memory tips. Vc is equal to Tv plus IRV plus ERV. Vc vital capacity, maximum air in and out. Tidal volume Tv, normal air in and out. IRV extra air in maximum inspiration. ERV extra air in maximum expiration. RV residual volume, remainder air in maximum respiration. Functional residual volume is the remainder air in normal respiration. Hope that you very well understood the previous two topics. Now let us go to the third topic. The third topic is pneumoconiosis or occupational lung diseases. Before going to the topic presentation, let us complete some important multiple choice questions. Hope that you have completed all the questions with the right answers. Let us go to the explanation session now. After completing this session, you will never get any wrong answers from this topic anymore in your exams. Occupational diseases due to inhalation of dust is known as pneumoconiosis. Occupational diseases can be divided into two types. First one is due to the organic or vegetable dust, and second one is due to the inorganic dust. Let us see the organic dust occupational diseases. First one is pagasosis due to cane fiber, bicyanosis due to cotton fiber, also known as Monday fever and brown lung disease. Tuberculosis is due to the tobacco, and farmer's lung is due to grain or hay dust. Next one is inorganic dust diseases. First one is anthracosis due to coal dust, also known as black lung disease. Silicosis due to silica dust. Asbestosis is due to the asbestos dust, also known as white lung disease. Siderosis is due to the iron dust, welder's disease. Remember these sentences. Monday brown cotton business. That is, bicyanosis is Monday fever, brown lung disease, and due to the cotton dust. White asbestos and black coal from Andhra. That is, anthracosis is black lung disease and it is due to the coal dust, and asbestos is white lung disease due to the asbestos dust. Third sentence is iron side welding. That is, siderosis is welder's disease which is due to the iron dust. Now let us go to the last topic of this session, that is topic 4. The last topic is prescription and administration of drugs. Like the previous sessions, let us complete the multiple choice questions before the topics. Hope that you have completed all the questions with the right answers. Let us go to the explanation session now. After completing this session, you will never get any wrong answers from this topic anymore in your exams. The start order should be administered immediately within 30 minutes. Single order to be administered at a certain time but only one time. PRN or SOS order should be administered a specific dose for a designated reason. Here the key point is to avoid confusion between stat and single order, because both these orders are single orders, but stat order is to be administered immediately and single order to be given at a specific time.
Thank you all for watching this video. Please add your valuable feedback. Subscribe this channel for more exam preparation videos. Thank you so much.